Good afternoon, Ankita. Are you there?
So you can please rename yourself.
Ankita, are you there?
Yes, sir.
Yeah, yeah. You can allow the participants to join.
So I will start the webinar right now, right, sir?
Yeah, yeah, yeah.
Okay. Yes, sir.
Okay.
Sir, I have renamed you, sir.
Ankita, so once the session starts, you'll hand over the session to me and I'll take it forward.
Sure, sir. Sure. Just instruct me
Ankita,
when
check your
you're on mute, Prachi.
oh, Ankita, can you check your chat box? I've sent you a mail ID, Dr. Pragya Sinha. She's saying I've received a message that she's not received the faculty mail. Can you just resend it quickly?
Okay.
Faculty mail. Yeah, or you can give it to me. I'll give it to her in the group. However.
Good afternoon, everyone. We'll be starting in 2 minutes time.
उस पे आ जाएगा उसमें डबल क्लिक कीजिए ना उस पे नहीं नहीं ये नहीं है नहीं Venkatesh, am I audible?
Yes, sir. You're audible, sir. Can we start the session, sir?
Yes, Venkatesh.
Yes, Ankita, please start the session.
Sure, sir. Good afternoon and welcome to one and all present in this session. I'm Ankita from Clanet. Clanet is very proud to be a part of this webinar as a digital partner. Now, I would like to present you all a short video of Clanet. Thank you so much, everyone, for all of your patience. Planet is India's largest live digital CME and doctor-centered medical content platform. Our website is www.planet.com, where we have lots of live sessions conducted by eminent speakers across the globe. And we have made Wiki services, which is medical Wikipedia for doctors only, that also you can read in your leisure time. We'll invite all the doctors to visit our website. Now, without any further delay, I would like to hand over the session to Dr. Venkatesh, sir. So over to you, sir.
Thank you so much, Ankita. Very good afternoon, everyone. It's my pleasure to welcome you all to our second webinar on the series Data Analysis Made Easy with Jamovi Software, which is hosted by the Department of Community and Family Medicine, AIIMS Patna, in collaboration with Merit India and Clarinet. Myself, Dr. Venkatesh Karthikeyan, Community and Family Medicine Postgraduate Resident from AIIMS Patna, and I'll be the moderator for today's event. I'm thrilled to see such a fantastic response for this webinar, with more than 2,400 participants registered from different corners of the country. As we all know, data analytics has become an increasingly important tool in healthcare industry, allowing doctors to analyze and interpret vast amounts of data to make informed decisions and improve patient outcomes. This webinar series aims to provide insight into data analytics and its applications in healthcare. I would like to thank our HOD, Professor Dr. C.M. Singh sir, and Dr. Samshar Ahmad sir, the Associate Professor of Department of Community and Family Medicine, AIIMS Patna, without whose support this webinar series would have not been possible. Now I'd like to welcome Dr. Pragya Kumar ma'am, Additional Professor, Department of Community and Family Medicine, and the Registrar of AIIMS Patna. Ma'am has over 50 research publications to her credit and has trained more than 5,000 young researchers across the globe through her workshops and webinars. With this short introduction, I would like to welcome Dr. Pragya Kumar ma'am. Over to you, ma'am.
So thank you, Venkatesh. Let me check. Is my audio okay? Because I could not check it initially. Venkatesh, can you hear me?
Ma'am, it is a little bit low, ma'am. Volume is a little bit low.
Okay, is it better now?
Yes, ma'am. Yes, ma'am. It's better.
Okay, thank you. So this is the second webinar on data analysis made easy with Jamovi. And without any further delay, I'll share my screen. And today we are going to cover the chi-square test. So this chi-square test, which is one of the very commonly used test of association. And if we see the types of chi-square test, so basically there are many types, but in this webinar, we are going to see the three types of chi-square test. The first one is the chi-square test of association, which is also known as the chi-square test of independence. The second type of chi-square test is the chi-square test of homogeneity. And then the third type we'll discuss, that is the chi-square test of goodness of fit. So let's see the conceptual understanding before we go into the data analysis. So first, coming to the chi-square test of association. So chi-square test of association, we'll see the basic concepts. What are the research questions for which we need to answer this chi-square test of association, the assumptions and hypothesis and commands, and then in the last, we'll see the summary of the chi-square test of association. So basically, if I want to know, if my research question is like, if I want to know the association between the gender, that is male and female, and the diabetes status, then I need this chi-square test of association. So how will I go about the study? So like I'll recruit the subject, I'll take those sample and I'll ask two questions. So the first question I'll ask, what is your gender? And from the same set of sample, I'll ask another question, are you a diabetes or not? Are you a diabetic or not? So I will collect the data. So in these two questions, you can see that there are two categories. Gender also I have kept only two options, that is the male and female. And diabetes also I have kept two categories, that is yes and no. So then there is something known as the contingency table. What is a contingency table? So basically a contingency table is a table where we cross tabulate two variables. So that's why it is also known as the cross tabulation, the cross tab, or two-way tab, which is an arrangement in which we classify the data according to two categorical variable. So there can be various types of contingency table, like there can be 2x2 contingency table. In this case, you can see that gender has been categorized as male and female and diabetes as yes and no. So this is a 2x2 contingency table. Similarly, you can have a 2x3 or 3x2 contingency table, in which you can see that on one side, the BMI category, which is a 3 categories, normal, overweight, and obese. And again, diabetes has got 2 categories, that is the presence or absence of diabetes. So you may, if you make a 2x2 table or 2x2 contingency table, you may get a result like this. So if you focus on table number 1, that you can see here, the male and female gender versus diabetic and non-diabetic. So you can see there are 80 men and there are 50 women. And if you see, it's equal, the distribution among diabetes and non-diabetes. Now focus on table number 2. Here you can see that the diabetic male are 45 in number and non-diabetic is 35. Similarly, the females are 20 diabetic and 30 non-diabetic. Now, coming to table number 3, you can see that diabetes, number of diabetic men are 60 and non-diabetic are 20. Similarly, the females are 10 diabetic females and non-diabetic are 40. So even if we don't use any statistical test, so without using any test, can we say that in which case the chi-square value or there would be association between gender and diabetes? So yes, you can see that in table 3, we can clearly say to some extent in table 2, and there is no association in table 1. So similar result you can see here, since the number are same in both men and women, so there is no association between gender and diabetes. In this case, we can say that yes, there is some association, but definitely in the third case, we can say that yes, the number of male, they are much more in diabetic category, whereas if you see the women, they are very less. So we can say without data analysis that men are suffering from diabetes more. The number of diabetic are more when the women, when the gender is men. So we can say that there is association between diabetes and gender. So what type of research questions generally we need this chi-square test of association? So let's see. So if I want to know the relationship between the BMI categories, And we have seen in the 3/2 contingency table. So there can be many levels, but here I have categorized the BMI category into normal, overweight, and obese. And then I'll see the history of cardiovascular disease status, that is present or absent. So again, this is a association. Similarly, if I want to know the association between surgical technique X and surgical technique Y and the occurrence of surgical site infection, I just want to see like in which technique the surgical site infection is present or more as compared to the other technique. Then also I would apply this chi-square test of association. And if I want to see the association between the quality of sleep, where there are two categories of quality of sleep, that is good versus poor, and academic performance, that is again good and poor of medical undergraduates. In that case also, we will use this chi-square test of association. So in all these three research questions, what have you observed? So we have seen that there are two categorical variable in all these three research questions, and we are trying to look for any association between those two categorical variable. So appropriate statistical test for such type of association is the chi-square test of association, which is also known as the chi-square test of independence. So this chi-square test of independence, it's alternative name of chi-square test of association. That means your null hypothesis states that there is no association between these two variables. That means variables are independent. Both these two variables are independent. And we can say, like in the previous example of diabetes and gender, the first table, if you can recall, where the number of men and women were equal, then we can say that there is no effect of gender on diabetes. So similarly, when we say chi-square test of independence, that means it is taking the name of that null hypothesis, because null hypothesis in case of a chi-square test of association or independence that says that there is no association, that means the variables are independent. But again, you have to be very careful, because there is only association if the chi-square value is significant, which we'll see in GEMOV. Then only the presence of association, it does not indicate that it is causal in nature. So for say that it is something is causal, we need to have other criteria. And we all know that for causality, it is the Hills criteria which we generally use. And again, this strength of association or the association is one out of the other criteria, but it is not the only criteria. So we cannot say that it is causal. Definitely, it is one step ahead. So by seeing other thing, we can decide about the causality. So now, before we apply the chi-square test, there are certain assumptions, and which we need to see those assumptions before we move to apply the chi-square test. So the first assumption is, like I said in the beginning, it cannot be applied over the continuous variable. That means the interval and ratio, we cannot apply the chi-square test. And that's how, if you read the history, it was the Pearson who invented this test. And generally all those tests which were available, like independent sample t-test or ANOVA, that was there for a continuous variable. So this is when you convert, you can convert the continuous into the categorical, then you can apply this test. So basically this test is applied when there are two categorical variables. There can be various levels of those category, like it can have 3 categories, 4 categories. So depending on the number of categories, you will have those contingency table. That means it may be 2 by 2, it may be 2 by 3, 3 by 3, 4 by 4, and so on. So depending on the number of categories, you may have a contingency table, but again, it should be a categorical variable, and we can only test 2 variables at a time. Again, the third assumption is the independence of observation. Now, what do we mean by independence of observation? That it says that the value should not be paired. What do we mean by that? Like if I have counted one individual, let's say I have approached a study subject named X, and I have asked his gender and I have counted him as a male and a non-diabetic, then that person is counted. I cannot keep this person in any other column. So that is what we mean by independence of observation. So now coming to the fourth assumption, which is the regarding the sample size. So generally we say that there should be a relatively large sample size for this chi-square test of association, because we say that there is something known as the observed count and there is something known as the expected count. We'll see this because this whole chi-square, the background, if you see the background calculation, it is in the numerator, we take the difference between the observed and expected. And since we don't want any negative value, that's why it is squared. So you will see that all the time the chi-square value will be in positive because we square it and then we divide it by the expected frequency. So this is the formula for the chi-square, and relatively large sample size should be there, because if the sample size is large, then there is one more assumption which says that the expected cell count should be at least 5 in each of this contingency table, in most of the contingency table. So now again, re-emphasizing on the independence of observation, we always say that there is no relationship between subject in each group. That means if we are studying gender, then we cannot take like pair of spouse, meansly husband and wife. We keep the female in one group and men in the another group, because that way they will be related to each other. So in any case, in the two, because the rows or the columns which we make in this case, the two individuals should not be related to each other and they should be independent. That's why we say even you should not take twins. Like if there are twins, and if there are twins who are gender is different, like male and female, then also you should not take. So you should take independent people who are not related to each other. So that is what they should not be paired in any ways. And one of the example of paired is like we apply paired t-test, where we count the same individual twice, before and after, pre and post. So that should not be the case here. And relatively large sample size, like I said, that expected cell frequency for each cell should be at least 1. It should not be a 0. And at least we say that 80% of the cell should have, that means we call it as a majority, at least 5 cell frequency in each of these cells. Now coming to the hypothesis. So if you see the hypothesis, we have got two types of hypothesis: null hypothesis and alternate hypothesis. So null hypothesis states that there is no relationship between the variables, and the alternate hypothesis states that there is relationship between the variables. And that's why you see that we call this chi-square test also as a non-parametric test. Because what do we mean by non-parametric? Generally, for calculation of, like, if you want to see the difference of mean, that we'll see in the next session, maybe that, paired t-test or the independent sample t-test, there we have an assumption, the null and the alternate in context of population, that is parameter. So you all know that we use this term statistics for the sample and parameter for the population. So because the null hypothesis takes into account of that population parameter, that's why the independent sample t-test, ANOVA, and the paired t-test, they are known as the parametric test. But in case of this chi-square test, here we don't consider this population parameter. That's why it is also known as the distribution-free test, or the other name is also like a non-parametric test. So this chi-square is a non-parametric because we are not taking into account of that population parameter, which we take in case of a independent sample t-test and the ANOVA. So now what is the expected frequency? So I talked regarding that this chi-square statistics is all about the difference between the observed and expected. So the smaller this difference is, that means this you are going to accept your null hypothesis and you are going to reject your alternate hypothesis. So just remember this, whenever you want your p-value to be significant, you will reject your null hypothesis. So if there is no difference, that means if there is no association, that means there will be very less or zero difference between the observed and expected. So basically, whenever you take this null hypothesis into account and you calculate the frequency, then the expected frequency is known as, the expected frequency. So this is defined as count in each cell if null hypothesis is true. That means no association. So if the two variables are independent of each other, then your observed count will be equal to the expected count. And that's why we say that if there is no difference between the observed and expected, or if there are less difference between observed and expected, you will not get a higher value of chi-square statistics. And in this case, I said that chi-square is always in positive sign, and higher the value of chi-square, chances of it getting significant are more. Now coming to another concept, which is the strength of association or effect size. So the strength of association in case of a chi-square test, we use a Cohen omega, or this, we call it as a Cramer-V also. So the value of both these two are same, and we see that the magnitude effect size, how do we describe? So if the value of this Cramer-V is 0.1, we call this as a small effect size. If the value is 0.3 till 0.3, we call it as a medium. And if this value of this Cramer-V is till 0.5 or more than that, we call it as a high effect size. And effect size is sample size independent. If you see the value of chi-square, if you increase the sample size, the value of chi-square will increase. But this effect size is independent of the sample size. And that's why these days you will see that wherever you will show the p-value and the confidence interval in any of the hypothesis testing, you should report the effect size also. So this effect size tells you how clinically that association is significant, whether that is small, medium, or large. So we define effect size in case of a chi-square test in the form of a value of Cramer-V. So before we move to the chi-square test of proportion, okay, so is there a sound issue again? Let me check. Is it okay or still the same?
Yes, ma'am, it is better, ma'am.
Better. So till now I was not audible in a good sense.
I mean, it was fair enough, ma'am. Now it is loud enough, actually.
Okay. Okay. So I should have done this before. I'm sorry. So I'll show you, I'll demonstrate. So this is my question. And for association, like I did I plan to do a secondary data analysis, and I have got 180 hospital records of COVID cases. And I want to know what factors were associated with the oxygen requirement of those admitted COVID cases at the time of admission. So I've got two research questions. Is there any association between the oxygen requirement and the smoking status of the patient? Or the second is there any association between the oxygen requirement and disease severity of the patient. So all of you who are there, because the data, we have shared the data set with you, and you can also perform the commands with me. So this is my Jamovi. And if you see, I'll just move this back. So this is the interface. So I'll just explain the data before I move to the commands. You can see that this is a data of COVID patients. So now what are the variables? You can see this is the option of variable. So if you see the variables, we have got these variables. And what are the categories? So this is the name, residence, hospital type. There are, if you double click this, you can see there is a hospital like type A and type B. Similarly, you can move down and see what are the other variables. So the other variables are like gender. Then it is the age. Again, there is a category of age group. SES is regarding socioeconomic status, smoking. DM is for diabetes, hypertension, CVD, stroke, COPD, chronic kidney disease. This is the total comorbidity. And this is disease severity. And again, this is admitted. So these are the other variables like hydroxychloroquine, steroid given or not, but those variables we are not testing in this session. That's why I'm not explaining. Coming to the data view, if you see the data, again, this is the, I will keep on scrolling and you can see this is the residence, this is the type of hospital, this is the gender, then age. And by the sign, you can see that if it is a scale, this is a scale variable, this is a categorical variable. So in the first webinar, we have discussed regarding the various tabs which are available in the Jamovi. And in Jamovi, you know that it has got, in the background, it is the R command which is running, and it has got a output and a data both in the same window, and it is a dynamic in nature. Once you shift the variable back to the window, that result will go. So now in analysis, in the first session, we saw this descriptives, where we calculated all the descriptive. And in this session, we'll see the count, this frequency or count. So coming to this frequency, if you click on this frequency, you can see here that it has got many options. So here for the chi-square test of association, I will use this. There is an option of contingency table. So if you see this, I will use this option. Under this contingency tables, you can see there is an independent sample or the chi-square test of association. So I'll just press this. We'll go to this independent sample and this window will open. So in the contingency table, you can see all these variables will be in the drop-down menu. You can see this dragging. These are the variables, and then there is a row and column. And here you can see you can only enter the ordinal variable or you can enter the nominal variable. So coming to this again, you can see there are various options. So the first is the oxygen requirement, which I have to test the association between the smoking status and oxygen requirement. Now there is something known as the concept of dependent and independent variable. So if you see dependent variable generally is the variable which we want to know, and we want to see the effect of independent variable over the dependent. So in this case, we want to see the effect of the smoking status. So smoking is a independent and dependent will be the oxygen requirement. So you can remember that in chi-square, we always shift the dependent variable in the column. So D and C, so just reverse. Generally we say A, B, C, D, but here D will come before C. So D is the dependent variable and it will go to the column. Just to remember, those of you who can remember it, that's okay. So this you can see that in the column, I will shift this. You can see dependent is the oxygen requirement. So this oxygen 1, I'll shift to the column. And then independent will be the smoking status. So the smoker, I will shift it to the rows. So once you have shifted this, you will see that there is a 2 by 2 contingency table and this value of chi-square will appear here. with a degree of freedom. Now, if we go down, you can see there is something statistics, and there are various options. So focus now over this area. If you see, these are the tests, and here you can see there are various options. By default, it is the chi-square, which is ticked, but there are other variants like continuity correction, likelihood ratio, Fisher exact test, Z-test for two proportion. So this is one. So here I will go for this chi-square. Now there are situations when you go for this chi-square continuity correction and Fisher exact test. So when the sample size is less, then you see the observed and expected count also, because one of the assumption. Now coming to the testing assumption, remember we tested that there should be assumption testing before we apply the chi-square test. So here we can say that the first assumption was both the variables should be categorical and it should have at least two or more category. So you can see here both variables are categorical in nature and it has got two categories, so that those two assumptions are satisfied. Third assumption is it should be independence of observation. So that's a study design issue, and I have assumed that the researcher has taken care of this point. And then the fourth one was the expected frequency in 80% of the cells should be more than 5, and none of the cells should have expected frequency of 1. So the frequency which we are seeing here, that is the observed frequency, that is not the expected frequency. So coming down, if you see, there is something known as the cells. So in this, under this cells, you can see this is observed count. So you can click on this expected count and you can just have a look over the expected count. So you can see expected is 89, 32, 42, and 15. So generally with this such large sample size, you don't expect any of the cell to have a expected count less than 5. So in this case, that assumption is satisfied. That's why I will uncheck this, because I don't want that expected. Generally, when you present your table, that expected count is not shown in the table. You just write in the assumption that none of the cell were having the expected count less than 5. So I just uncheck that, but again, you want percentage. So here, since I have, there are many participants who always ask this question, whether you should give a result in a row-wise percentage or in a column-wise percentage. So remember, if you have decided what is your dependent variable and what is your independent variable, if you are very sure, generally we are sure because it's we who want to see the effect of one variable over the other variable. So you classify which is the dependent and which is the independent. And then you are moving the dependent variable to the column. Remember, by DC, then there is no confusion at all. You have to give the percentages as row percentage. So that's why you should click row percentage if you have taken care enough in the beginning which cell you are moving into row and which cell you are moving into the column. So this is the row-wise percentage. And then you can see here, because I want to see the effect of smoking on oxygen requirement. So I can see that 69% here, you will see that in Jamovi, it takes no first. So you can see this is the requirement in a non-smoker. And here you can see that oxygen requirement was 17% in case of, you can say that people who were smoker, and oxygen requirement was 69%. So this is saying that oxygen requirement was more in non-smoker, and it was, if you see the requirement, so this is no and this is yes. So they are better. The people who were non-smoker, they did not require oxygen. Whereas people who were smoker, you can see 17% of them, they required this oxygen. So now this is the one, and then you can see the effect, that is the effect size, which is the Phi and Kramer V. And you can see here that this is the contingency Phi or Kramer V. If you click this Phi or Kramer V, you can see the effect size. So effect size is 0.15. So remember, we said that if it is still 0.1, it is a mild effect size. So this effect size is very mild, although this is significant but very borderline, because it is P is 0.04. So just borderline significant, because the value of chi-square, it should be 3.84 if it is more than that. So this is just slightly higher than 3.84, which is 3.89. That's why it is. So we will write that at 1 degree of freedom, the value of chi-square was 3.89 and the p-value was 0.049. So this is how we will, you can directly copy paste this table and modify a little bit. Like I'll show you, we have just shown, this is the APA style table. You can see the oxygen requirement was there in 17% of the smoker. Whereas if you see the non-smoker, the oxygen requirement was 31%. So you can say that the oxygen requirement was twice in non-smoker as compared to the smoker. So this is how you can present your result in case of a chi-square test of association. Now there was another question, which is the oxygen requirement with disease severity. So that is, if you see this, so this is the result. If I move again back to this smoker here, and then the disease severity, this I will move to the row. So this you can see, it will buffer for some time and then the results will appear. So again, you can see the observed count, and since it is a 3/2 contingency table, you can see it is severity is like asymptomatic or mild cases, moderate and severe. Again, you can see the Kramer V. If you come down, again that effect size you can see. Can you see here that this phi is writing NaN? Because generally phi is there when the table is 2/2. If the table is 3/2 or more than 2/2 contingency table, then you will not get this phi coefficient. So this is how. Again, there is an option of layering. Can you see this layer? So if you want this layering as a gender, again you can move this and you can see it will give you like gender, male, female, disease severity, and then oxygen, no NES. So you can create layers. If you can, like, if you want to have any other layer also, you can insert that. So then the table will be very complicated. You can see it will have first layer as socioeconomic, then gender, and then disease severity, and then probably the no NES. So that way you will see that the table will be very huge. And then it will give you the chi-square value in each of these layers. So this is how we calculate the chi-square test of association. Regarding this significance of this continuity correction, we apply this continuity correction when the sample size is less than 40. And if your contingency table is more than 2/2, in that case, because generally what happens that this chi-square distribution, the data which you have collected, the sample, we assume that it follows a chi-square distribution. But in case the sample size is less, that does not follow the chi-square distribution. Hence, for making that correction of distribution, we use this chi-square continuity correction. But since here the sample size is 180, that's why it's not needed. This Fisher exact test is also applied when the cell count, expected count in cell is less than 5. And that usually happens with the less sample size. So that in that case, we apply this Fisher exact test, which gives you the exact value. And then we report that. So they are the two options which generally we do when one of the assumptions which we have said in the beginning, that is not met. And usually that assumption is the expected cell frequency in cell, in any of the cell. So that is regarding the chi-square test of association. Now coming to the second, we can say that the chi-square test of proportion. So this chi-square test of proportion is slightly different from the chi-square test of association. Although in this case, you will see that we make 2/2 contingency table. But how it is different from the chi-square test of association, we'll see that. So this chi-square test of two proportion, here the main important thing is the way you have conducted your research. So in the chi-square test of association, you start with one sample and then you see both the variable in that sample. But here in the chi-square test of two proportion, remember it's two. So two, since beginning you have taken two independent group. It is not the single group and then you have categorized. So two independent groups since beginning you have taken, and then your dependent variable is dichotomous, and it is also known as the chi-square test of homogeneity. So now there is something known as the binomial proportion, because this chi-square test of homogeneity, if it is a 2 by 2, then generally we say that the proportion should be binomial. So what do we understand by binomial proportion? That means that for this example, I'll quote this example, that I have recruited 50 males and 50 females. So remember, I'm not saying that I have recruited 100 individuals, and in that case, there may be 30 women and 70 men. So that proportion will be different if I take the 100 sample. But I deliberately, because I said in the beginning that the study design of such type where you have to apply this chi-square test of homogeneity will be different. So since beginning, I have recruited 50 men and 50 women. And then we say that the binomial proportion. So if I say that the proportion, the 4 male had a heart attack, and in 50 female, if I say that 8 females had a heart attack. So what will be the number of men who who had a heart attack? So it will be 4 by 50. So the proportion will be 0.08. Similarly, if I write the proportion of the females having higher heart attack, it will be 8 by 50. So it will be 0.16. So then I'll say that not having. So proportion of males not having heart attack will be the 92% because 8% had heart attack. And the proportion of females not having heart attack would be 84% because 16% had a heart attack. So that's the concept of binomial proportion. Means you give the proportion of something and the next part will be not having that particular thing. So that is the binomial proportion. So what type of research question generally we say in case of a chi-square test of homogeneity or two proportion? So if I want to know what the proportion of BMI, what is the proportion of BMI category? And I have categorized it into two, like normal and high of MBBS student of AIIMS Patna and AIIMS Delhi, whether they are equal or not. So again, you can see here that AIIMS Patna, that's a separate population. AIIMS Delhi, that's a separate population. So I have taken two different populations. And then I am seeing the proportion of a particular outcome. Similarly, in the second question, like if I want to know the comparison of two units, so maybe I'll take unit 1 and unit 2 of a surgical department, and then I'll see whether the surgical site infection rate of unit 1 and unit 2 are similar or not. And a third research question could be like if I have taken one rural village and one urban village, and if I want to see what is the proportion of COVID cases in urban area and in rural area. So in all these three examples, you can just appreciate that we are taking two independent samples since beginning. And then we want to see the proportion of a particular outcome. And that proportion is also a binomial. It is not into three, only two, like proportion of having something and the other will be not having. So in all these three research questions, we have seen that we want to know whether the proportion of the category of a nominal variable in our study is equal across the different population or not. So appropriate statistical test in such type of research question is the chi-square test of two proportion, also known as the two proportion test. So now, because you had just seen the chi-square association, so now just with one example, I want to emphasize the difference between these two, because many times you will see in journal, the people, they apply the chi-square test of association if it is a chi-square test of proportion. So you should be careful what is a requirement and what is a research question. So suppose if you have to apply the chi-square test of association, in that case, you will take a sample from single population. So you start with one population and then you measure the two variable in the same population. Like maybe the diabetes, in this case, you can see this is a single population. And then I am seeing the diabetes status and the obesity, obese, non-obese, diabetic, non-diabetic. Coming to the chi-square test of proportion in the similar example, then how will I do chi-square test of proportion? I'll start taking two different populations. So I'll take non-obese and obese. And most of the time, we take the equal numbers in both these two. So I'll take non-obese and obese, and then I see the proportion of diabetes in both these populations. So in case of a two proportion, we always start with two population, and those two should be independent population. And then we look for the proportion of one categorical variable. So underlying assumption in case of a chi-square test of two proportion is again, there will be one independent variable and one dependent variable, and both measured on a dichotomous level. Again, the independence of observation concept we have seen in the previous example, that is the chi-square test of association. That is like if you have counted one individual once, you will not count that individual in another case. First is this. Second, if you are like having, people should not be related to each other. They should not be the husband and wife or twins in a sample, because then some observation will be related. It will not be a independence of observation. And like I said, that it can be used only for a certain type of study design where you start with two population. And again, like this chi-square test of association, here also the expected cell frequency should be greater than 5. So what is the null and alternate hypothesis? So null hypothesis is again, the proportion of the variable of interest is equal in two population, and they are not equal. So coming to this, it is basically used in two type of research design. The first research design could be like if you do the random sampling from two independent population. So like again, in this case, you can see there is one population of doctors. So this is a population of doctor. This is one independent population. And this is a population of nurses. This is another independent population. So I have started with two independent population, and then I took people from these two groups, and then I compared the proportion of variable of interest, that is the diabetic. The second type of research design could be, I may do the random assignment of two intervention. Like in case of a randomized control trial, what I can do, I can assign a few people to intervention 1 and few people to intervention 2. So if I do such random assignment to intervention, then also, and I'm measuring the outcome in both these intervention group and the control group, or intervention 1 and intervention 2. And if I see the proportion of the outcome, difference in proportion of the outcome in the two intervention, because in this case also you can see that there are, although we have started with a set of people, but there are two different group, and I want to see the outcome. So this chi-square test of two proportion can be used. So before I move to this chi-square test of goodness of fit, I'll again show you the questions which are there. So you can see here, this is the chi-square test of two proportion, which is also known as the test of homogeneity. And in this case, you can see that the question is, if I want to know whether the proportion of male and female COVID cases in type A and type B hospital is equal or not. So I have to check this. I have to use an appropriate statistical measure to check this research hypothesis after applying the assumption. So I'll again come to my data set. So this is the data set. I'll move this back to this variable window, and then you will see that everything disappears from this. So in that case, if you want to preserve that value, what you can do, you can right click a particular result, and then you can use the option of duplicate. So this, you can either copy it and you can paste it, or either you can just select it. You can go to analysis, and in analysis, you can click on the option of duplicate. So like I said, in SPSS and all other software, the output which you get, that is in a separate window, and the data set is in a separate window. That's why there in variable, this thing also, there are two views. There's a variable view and there's a data view, and output comes as a separate view. In case of a Jamovi, you are having everything in the single view, and it is dynamic. In SPSS, if you have moved that output is there, it will not go back unless and until you don't save it. But in case of a Jamovi, you can keep on doing the analysis and seeing which one is significant or which you want. In case you want, you can duplicate the result or you can copy paste it. And if you don't want, then you can again move these variable back to the window. That's the difference between the SPSS and Jamovi. And again, in the background also, this Jamovi is an open source. SPSS is a paid one. And if you buy that subscription, maybe that is for 1 year. And if you use a pirated one, then I don't know whether you can write it or not. And there are many options which are not available in pirated one. But in Jamovi, it's an open source software. And you can definitely quote this, that you have used Jamovi as an analysis, this thing. It is not something that you cannot write it. So that we have covered in the first webinar of Jamovi, where we have shown you how Jamovi is different from SPSS data or other software, and what are the pros and cons. Definitely, this we are not saying that this is the best, but for the beginners who want to do a stress-free data analysis, this interface is easy. And again, this is free for everyone. And command-based, it's again menu-driven. You don't have to write the commands. So as a medical or as a medical researcher, I think most of the functions we can do over the Jamovi. So now coming to the same question. So the research question was, I have to see the male and female proportion in type A and type B hospital. So this hospital type is an independent variable. So I'll move this to row, and then the gender in this case is a dependent variable, because I have to see the male and female, whether the proportion is same in the male or female or about in the two hospitals. So you can see here, now in this case, instead of chi-square, you will click on this Z test for difference of two proportion. So yes, can you see here the Z test of difference of two proportion? And you can see now, you can see hypothesis testing also. So here it is writing that group 1 is not equal to group 2. So this is again two-sided hypothesis, because the other two options, they are the one-sided hypothesis. But we go with the two-sided hypothesis. That's why by default, this hypothesis is clicked. And then this Z test of two proportion, if you come to the cell count, again, you can see that row-wise percentages are there, and this is the observed count. If you want to see the expected count, you can click this also, but we have seen this with the previous one. That's why I'm not clicking this. And there you can see, like in case of a type A hospital, 67% are male, whereas in type B hospital, 78% are male. And we can see the value of chi-square, that is 1.72. And this is the 0.085, which is not significant. Again, coming to the phi and Kramer V, you can see here it is 0.13, which is of a very mild effect size. So these are the various options in the chi-square test of homogeneity or chi-square test of two proportion. Again, coming to the third type of chi-square, which is the chi-square goodness of fit. So now I'll move this. So again, if you see, if I move this back, this result will go. So this Kramer V is basically, so there are two terms here, phi and Kramer V. So basically this phi and Kramer V are the effect sizes calculation. So there's a formula, and you can again calculate the value of phi and Kramer V from the chi-square value also. but we are not going into the detail of this formula. This is calculated basically, and this tells you how significant your association means. Significant value, you have seen it from the p-value. So basically that p-value gives you the statistical significance. But if you increase the sample size, what will happen? We have learned this, that if you take too large sample, then even a small difference will be significant. For example, if a new drug has come up and it is decreasing only the systolic blood pressure by 1 millimeter of mercury, but you take too large sample, then even the 1 millimeter of mercury will be like very highly significant. So by increasing sample size, you can achieve a statistical significance even if there is a very little clinical significance. But these effect size, and you can see this phi and Kramer V, and again I said Cohen effect size. So these effect size are independent of sample size. So this independent of sample, since this is independent of sample size, that's why it will tell you exactly the clinical significance, whether there is any clinical significance is attached, because significance we always talk in two terms. There is a statistical significance and there is a clinical significance. So for clinical significance, we need this effect size. So how to report it? Again, you will write it that the value of Kramer V and phi, I said that phi coefficient is there when there is a 2x2 contingency table. If the table is more than 2x2, that means more than 3x3 or 3x4, then this phi coefficient will not appear. It is only applicable for 2x2. So you can report, and then I have shown you in the table that if the value of this Kramer V is 0.1 till 0.1, then it is of very low effect size. Moderate effect size, we say if it is still 0.3. And large effect size, we say when it is still 0.5. So again, if something is non-statistically significant, like in this case, if I move that hospital type here in the rows and gender in the column, then you can see that this is not significant at all. If you see the value. So it is 0.08. So 0.08 is not significant. So if there is no statistical significance, in that case, you don't need to report for this phi and Kramer V. So maybe I'll uncheck this. So you can do one thing, like you only check this once you see that there is some statistical significance. So I hope you have got your answer. Then again, there's one question. Can Fisher test be used even if the values are more than 5 in each cell? Yes, you can do that. Fisher test can be used in case of any frequency which is there in each observed frequency or observed count. So that's why even if it is more than 5, you can use a Fisher exact test. And at larger sample size, you will see that it will be the same almost. There will be very less difference. So that can be done. So again, to repeat, you will report effect size only when there is a statistical significance, because I said that effect size is independent of the sample size, and statistical significance you will get if you increase the sample size. So if there is a large sample, you will definitely get the statistical significance, but you will not get a clinical significance of the effect size because it's independent of the sample size. That's why you should report both the statistical significance and the effect size. And this effect size, as you can see here, that we report only if there is a statistical significance. So now coming to the, again, third one, that is the chi-square test of this goodness of fit. So we have learned till now the chi-square test of association. Then we have seen the chi-square test of two proportion, which is also known as the chi-square test of homogeneity. And we saw what was the difference in the study design if you are doing a chi-square test of association and if you are doing a chi-square test of two proportion. Coming to the third type of chi-square test, which is the chi-square test of goodness of fit. So when you will do this chi-square test of goodness of fit? So this is very much similar to the, if you can recall, one sample t-test. So this is similar to that, and we'll see how it is similar to that. So basically, when you have only single categorical variable, and if you want to see the distribution of cases in a single categorical variable and how it follows a distribution, then probably if that there can be two possibilities. That distribution can be known or that distribution can be not known. So if the distribution is known, definitely that will be unequal. But again, if that distribution is not known, you may hypothesize a distribution, and then that hypothesized distribution is you assume that it is equal. So when you compare your distribution with a hypothesized distribution, which is equal, in case it is known, then it will be unequal. And this is known as the single sample non-parametric test, which is also known as the chi-square goodness of fit test. So it basically tells you how fit your data is with the population from where you have drawn your sample. As for example, in this case, if you see the prevalence of obesity, if it is there in 5% in Indian children, that is a known. Maybe through NFHS data, you know that the prevalence of obesity is 5%. Now, you are doing a research where you have 90 children in your study. So what will happen? If you take that 5%, then that 5% of 90 will be the 18 cases. No, if you are having 18 cases of obesity, it is basically 20%. So if you are expecting 5%, that means, but you will see here that 20% are obese cases. But in your case, you have seen again another study that there are 25 cases of obesity. So this number is higher because out of 90, if 25 cases are there, then definitely I'll see that this is larger than the 5%, which is a national average. So if I have to compare my sample proportion in a single sample from against any known proportion, then it is higher definitely. But whether this high is significant or not, for that I need to use the chi-square goodness of fit. So what can be the research question for which I'll use the chi-square goodness of fit? So first is, if I want to know whether the proportion of BMI categories, and I have got maybe the BMI category you can have as a 2 category or a 3 category of MBBS student, is it different from the national proportion? Then probably I'll go with this chi-square test of goodness of fit. Keeping the same example, if I want to know whether the surgical site infection rate of my ward is different from the overall surgical site infection of the hospital. So I will have a data of my hospital, and if I want to see whether that if my ward is having a lesser surgical site infection rate than the hospital or more than my hospital, is that proportion is statistically significant or not? Then also I may use this chi-square test of goodness of fit. Or if I want to compare the passing percentage, like I can say that in my AIIMS Patna, 70% of the students, they passed. But like any other college, if I compare, and I may say that no, there the proportion is different and I want to compare. So in that case also you can use the chi-square goodness of fit. So in all these cases, what have you observed? In this case, you will know that there is only single variable. So you want to know whether the proportion of various category of a nominal or a ordinal variable in my study, does it follow any known or hypothesized proportion or not? So the appropriate statistical test for such type of research question is the chi-square goodness of fit, which is also known as the one sample chi-square test. And you know, since beginning, I have been saying that this chi-square test is dependent on the observed and expected count. So the larger the difference between the observed and expected, the higher the value will be the chi-square. And since you square this observed and expected, so it will always give you a positive value of a chi-square test. So now again, like we did the assumptions before we go for testing, in this case also you have got few assumptions. So the first assumption is there should be one categorical variable. And that one categorical variable should be, it can be a dichotomous. What do I mean by dichotomous? That it should have it two categories, like maybe gender, male and female, diabetes, yes and no. This is a dichotomous variable. What is a polytomous variable? So when a variable has got more than two categories, then we call it as a polytomous variable. Like obesity. If I classify obesity as mild, not mild, maybe the normal, overweight and obese, then there are three categories. So any categorical variable having more than two categories are known as the polytomous variable. So the first assumption is there should be one categorical variable, and that categorical variable can be a dichotomous variable or can be a polytomous variable. The second assumption is the independence of observation. And independence of observation is like if you have counted one, and in this case, we will take only a single variable. So if you have counted one individual in one category, we are not going to count that in the other category. And again, like all other chi-square tests where we have kept this assumption of at least expected cell frequency. And mind it, I am again emphasizing it as a expected. Many times what our PG students, they do, they see the observed count and then they take a decision of applying Fisher exact or continuity correction. But the table which this gives as an output, it shows you the observed count. So you need to click that expected count to see whether than any expected. In SPSS, it gives you, like if you click that, it tells you in a star mark that these many cells are having expected count less than 5. But in Jamovi, you need to see it. So, and you need to click it. So the expected cell frequency in each of the cells should be at least 5. So this chi-square goodness of fit test, it compares the observed frequency in the categories with hypothesized frequency. So there may be two conditions. First condition can be like I have this hypothesized proportion available. If that hypothesized proportion is not available, then what it does, it takes it to be equal in proportion. And that's how it tests the hypothesis. As for example, in this case, you can see, I am focusing now on this part. So suppose you recruited 100 individuals in your study to know whether the proportion of normal, overweight, and obese categories are significantly different from hypothesized population. And in this case, you know that the hypothesized population proportion of normal is 50%, overweight is 40%, and obese is 10%. Coming to the second, so this can be, so if you have got some known proportion, you can test that. Now coming to other proportion, you can see here, this is another example where you have recruited 100 individuals in the study, but I don't know because that hypothesized population is not available. In that case, what will I do? What this software does, this basically assumes that all the individuals are equal in 3 groups. So proportion of normal, overweight, and obese, it will assume that they are equal in proportion. So I'll show you how to do this. So if I go to this research, this question, this was the homogeneity that we have seen, and now coming to the third, that is the goodness of fit. So the question is, like, if I would like to understand whether the proportion of various disease severity of COVID cases admitted in my hospital follows the same proportion as those at national level, where it is known that 10% are severe, 20% are moderate, and 70% are mild. So I have to use an appropriate measure to check whether the observed frequency to disease severity is significantly different from the expected frequency of the disease severity. So going back to Jamovi, again, I will move this back. And in this case, you have to click this option. And now you can see there is a option of this chi-square goodness of fit. So you click this chi-square goodness of fit. Here you will see there is only one variable, because we said that there is only one variable in this case, and that one variable was the disease severity. So maybe I'll go to this disease severity, and I have entered this. So it is saying that the proportion of asymptomatic is 70%, moderate is 19%, and severe is the 12%. And now it is saying that it is significant. But again, in this case, if you have not written anything, if you come here and if you see expected proportion, so it takes, remember, I have shown you that if you don't enter anything here, then it takes it to be equal. But here I know that the proportion are 70, 20, and 10. So what I'll do, I'll convert it into the ratio. So asymptomatic will be the mild, moderate is 2, and severe is the 1. So if I enter this this is again known, because I know that this is the known proportion. So you can see that the value of chi-square, this is 0.75. This is p-value. Value of chi-square is 0.56. And this p-value is 0.75. So this is not significant. You can also write here as I have taken ratio. Obviously, it will be the same because 0 will be different. It will be cancelled out. So even if you enter 7, 20, and 10, the result will be the same. And like we have seen the other options of this expected count, you can click on this expected count. It will give you the expected. So you can see there is a very less difference between the expected and observed. So I said that if the difference between expected and observed is very less, then you will get a very low value of chi-square. Why? Because the chi-square value is calculated based on the difference from observed and difference between the observed and expected. And we square it and when we divide it. So ultimately, here you can see that the observed is 124 and the expected is 126. The observed is 35 and expected is 36. The observed is 21 and the expected is 18. So that's why you are getting a very low value of chi-square. But again, if you don't keep anything here, and if you go by that equal proportion assume, in that case, you will see that then it will be, then again, you need to click here. Once you have changed something in the input, in the output, you need to again click because then it gets refreshed. And here you can see that the value of chi-square, it is now 104. Initially, it was 0.56. And it is again significant. So this is the basically the chi-square test of goodness of fit. So now again, to summarize, we learned 3 types of chi-square. The first 2 options, the chi-square test of association and the chi-square test of 2 proportion, it comes through this option, which is the this contingency table, this independent sample, and then the chi-square test of 2 proportion. So you can see here that basically the chi-square test of association, we start with 1 sample and then we measure the 2 variables, categorical variable, and then we move the dependent variable to the column and independent variable to the rows. And then we click the option, which is the default chi-square. But again, we should check the assumptions. So what are the assumptions? assumptions of chi-square test is like it should be a categorical variable that is there, and there should be 2 or more category that is also there. And then we should test the independence of observation, which is a study design issue, and we have assumed that the researcher has taken care of this point. And the fourth is regarding the expected cell count. So you can come down and you can click this, you can go to this cell. So if you click this arrow, this cell will be appearing, and instead of this observed, you will also click on this expected count. Then you can have the expected and observed both. Like for example, I was just telling you, maybe if the gender is this thing in smoking status, like we have seen initially, this one, smoker and gender. So you can see the expected cell count, and if it is more than 5, then you can go ahead with the chi-square. If it is less, then you can go with the Fisher exact test. And we were discussing regarding Fisher exact. So yes, you can also apply Fisher exact test here. You can click, and then you can see the value of Fisher exact, that it is 0.8. If you see the value, 0.69 and 0.72 in case of a Fisher exact and chi-square. And then again, I can go to this option, and in case of this phi and Kramer V, which gives you the magnitude of the effect size. So effect size, like if it is 0.1, it is of mild. If it is 0.3, it is moderate. And if it is 0.5, it is a good effect size. So yes, there is one question, phi and Kramer V. So I have answered this question that phi is calculated in case of a 2x2, Kramer V is calculated for all. So that's why phi you will not get this output if it is a more than 2x2 table. Then again, one participant is asking regarding in the criteria of at least 5 in each cell, is there is 20% cutoff? Yes, generally we say that 80% of the cells. Each cell should have at least one expected count, and 80% of the cell should have at least 5 expected count in each cell. So that is there. And then again, Dr. Vijayan is asking, what about the count option in the goodness of fit? So basically that count option, if you see, that is there in all options. So here many times what happens, for that you need to arrange the data. So many times you will see a 2x2 count, only frequency is there, and that whole individual data set is not there. Then you can use this option. But generally we have this option of data. That's why we don't use this count option. It is there in all the 3 types of chi-square. Then again, I was telling you regarding the chi-square test of 2 proportions. So this was chi-square test of homogeneity. And I have again told you, you will report phi and Kramer V, or Kramer V rather. That's why remember Kramer V, because phi is only for 2x2. So in that case, you should if there is no statistical significance, there is no point giving the magnitude of the effect size. And then again, you can go with this writing the description, and in description, do write the assumptions also regarding this, at least with the 5 cell count. And then you can see the chi-square test of 2 proportion. Here instead of that, so we start with the 2 type of population. So if it is a chi-square test of 2 proportion, we start with the 2 population, and the 2 populations are different, independent. Like I have given you example of male and female separately, urban and rural separately. And then in this case, like with the type of hospital. So there is a hospital type A and hospital type B, which is the independent variable, and the dependent is gender. So again, instead of chi-square, I'll go with this chi-square test of 2 proportion. So this chi-square test of 2 proportion, if you see, again, you can see that the male and female proportion, and it is not significant. And since it is not significant, I will not click this phi and Kramer V. And I'll just report that the proportion is like it is not significant, the male proportion, whatever it is, like 60%, 67% in type A and 62% in type B. So you have to describe this 2x2 table. And then you will say that whether that difference which you are observing, that is significant or not. So again, there's one question, what is expected variable? So expected is, again, it is a count, basically. So expected count, like if you can recall, I said you that when you take the null hypothesis, then it tells you, like, even if you don't have gender, in this case, you can see the total is 50%, and this is your expected is 50 and 130. So if you see this proportion and you apply the same proportion to these individual cells, that means if there is no association between the gender and type of hospital, then what will happen? Then it takes into account that phenomena, and using the null hypothesis, it calculates the expected count. Again, there is a statistical formula, you know, that each expected we write like that particular count divided by row total and column multiplied by row total and column total, but we are not going into the detail of that calculation of expected cell count. You just remember the concept behind it, that it takes into account of that null hypothesis. So what null hypothesis? It says that there is no association. Using that, it calculates the expected count. You should see that expected count and report that most of the cells were having a cell count of more than 5. So there's again one question that can we write yes followed by no? In yes, you can do that, because Jamovi, I said that it writes yes and no. It writes no first and then yes, then you can reverse that, because I know that writing no first is generally we don't do that. So you can reverse the figures when you are transferring the value in your table. So this was regarding the chi-square test of two proportion. Again, going back to chi-square test of goodness of fit, that we see from the option, which is a separate one. This is the for goodness of fit. And then since it is this thing, you in this case, we were seeing the disease severity. So I will shift this disease severity, and this count option is there in all the three. And then you can have, but here the data needs to be different. You cannot use this option the way we have an Excel sheet. And then this here, if you don't enter anything, then it takes it as an equal proportion. If you enter a value, then it gives you the different. Like in case it was, in our case, it was 7, 20%, and 1. So then if you enter this and if you see the expected count, you can click this expected, and you can see the difference between expected and observed, and lesser the difference. Again, that is there with everyone. Lesser the difference, more is the less is the value of chi-square. More the difference between observed and expected, larger the value of chi-square, and more chances of it to be significant. So that's the 3 type of test in chi-square: chi-square test of association, chi-square test of two proportion, and chi-square test of goodness of fit. Generally, Fisher exact test, the calculation is a little different. So it gives the value of 2 by 2. But again, if it is more also, these days, it gives you the value of Fisher exact test, even if it is a more than 2 by 2 contingency table. So I hope, I think I have finished a little early. Still, if there are some more questions, I can answer. I can see the question and answer. Can you share entire video? Yes, we will. It is there in the YouTube of Merit India. Okay, and I'll just show the last slide. So this is the last slide. You can write us at support@meritindia.org. And there's a website, which is the meritindia.org. And we have got all the videos also on the YouTube. So you can, if you have missed the first webinar, that is also, have you uploaded them? Yes, we have uploaded. So you can visit to the YouTube as well as on the website, and then you can see those videos. There are a lot of videos of Jamovi also. So then you will come to know, like many of you are asking how it is different from SPSS, what advantage this Jamovi gives. Especially like we are having we had this session on questionnaire development, that is the scale development. So if you go to the SPSS, you will have to like take another subscription of SPSS AMOS for the scale development. It only has an option of that PCA, which is the principal component analysis. The other options like confirmatory and factor analysis, it does not have. But in case of a GEMOV, you are having all the three options. So for most of the work, this GEMOV works good. But again, those of you who are very well versed with all type of software, then you can go with the any software. This is basically, we are focusing more on the novice learner who has got a statistical anxiety, fear. Maybe they don't feel comfortable handling data. They think that this is something which is not a cup of tea for us. So that's why I think this GEMOV works wonders for them who are like beginners. Once you are like, there will be many people who are very good in data analysis. Then you can go with any of the option, right? So basically, this webinar is for those people who have just started or maybe new into the data analytics. So I think I'm done with my, if there are any other questions, then I may take those questions.
Ma'am, can I conclude, ma'am?
Yes, I think so. Maybe we are ending a few minutes early, but that's okay.
Thank you, ma'am. Thanks a lot for the wonderful session, ma'am. I hope all our participants had benefited out of today's webinar and the ongoing webinar series. We'll be sharing the e-certificates and the resource materials, including the videos, to our registered participants via email in 1 week time. Our next webinar on this series will be on June 13, the link of which we will be sharing with you shortly. As the last part of today's webinar, I would like to invite Dr. Samshad Ahmed sir, Associate Professor of the Department of Community and Family Medicine, AIIMS Patna, to deliver the vote of thanks.
Thank you, Venkatesh. There is some ego. Hello. Am I audible, Venkatesh? Is there any?
Yes, sir. No, sir.
Okay. Okay. So this is our second webinar series. I think we are getting some echo. Okay. This is our second webinar of data analysis made easy using GEMOV. Earlier, we did a webinar with sample size calculation, but right now it's a basic webinar, and we will keep it doing every month on every second Tuesday as usual, and it will continue till next year January. We have lots of other topic like correlation, ANOVA, t-test, pair t-test, logistic, and whatever the basic data analysis a medical researcher should know. We are trying to cover all those topics in next coming few months. And after that, we have a plan for another webinar series on sample size made easy using G-Power options. So with Merit India, you will, I think, and with the support of Clanet, we will have a lots of series ahead on data analysis, on sample size, on epidemiology, and we are working. And regarding the same, request received by the participant that whether we are sharing content, what about video. So once again, we want to ensure from the Merit India side that all our contents, all our video, all our data, that is freely accessible to all our participants. They can use it, they can learn it. For that, they have to visit Merit India website, and there they have to log in, they have to create an ID password, and then they can access everything there. In the case of any query, any support, they can write us to our mail. We will try to revert back as soon as possible. So again, thank you all for participation, and stay connected with us. Thank you, Venkatesh.
Thank you, sir. Thank you, everyone. We can close the session now. Team Clanet.
Hello.
Thank you so much, everyone. Thank you for your valuable time. So with all your permission, we are concluding the session over here.
Yes, please.
Thank you, everyone.